Hi, my name is Andrea Duart. I'm going to be doing my head to toe assessment. Here's my ID badge. I'm going to do a room scan while my patient reads the disclaimer.
I, Leonard Duart, voluntarily give Maryville University permission to record my image and or voice and grant Maryville University all rights to use this recording in any medium for educational or other purposes that support the mission of the university. I understand that the following information will be gathered by a Maryville University student as part of the course assignment. I give my express consent for this information, gathering the physical assessment to be filmed and posted in the student's course shelf for access by faculty and students at Maryville University. I further acknowledge that since this recording is for educational purposes only, that the information is not meant to be diagnostic. Therefore, Maryville University, its faculty, staff, and students are not considered liable. The recording will be deleted by the student and any other devices as soon as it has been reviewed and graded by the instructor.
Okay, I'm going to start by having some I did some hand hygiene. I'm going to enter the room. Hi, my name is Andrea. I'm going to be a nurse practitioner student doing a head to toe assessment. Can you please tell me your name and date of birth?
Leonard Duart, 5'11", 73.
Okay, perfect. I'm going to start out by taking a look and feel at your head. I'm just feeling for any abnormalities. I'm looking for symmetry, contour, and it looks normal. I'm going to be looking at your face. I'm looking at your, for any involuntary movements, I'm looking for facial expression, and everything looks good. I'm going to start by looking at your eyes. I'm looking just at your lids, lashes, palpebral fissures. Everything looks good there. I don't see any abnormalities. I'm going to have you look up. I'm looking at your conjunctiva and your sclera. I don't notice any injection or any drainage or anything of that nature. And also looking at your cornea, lens, and pupil. I don't see any opacities. Your pupils look round and equal. And everything looks good there. I'm going to check your cranial nerve number 2, which is your optic nerve, by doing a Snellen exam. If you can take this. I'm going to use this chart 6 feet away. I'm going to have you cover one eye. Read the lowest line that you, or the smallest line you can read.
EPTZO.
Perfect. And then I'm going to have you cover the other eye. And I want you to read the smallest line you can read, but in reverse order.
HPFTL.
Okay, perfect. Thank you. Now I'm going to check your pupillary response. If you can just look right at me. I'm looking for direct as well as consensual constriction of your pupils. Looks good. And then if you can follow my pen light in, awesome. I'm also going to check your cranial nerves 3, 4, and 6, which is your oculomotor, trochlear, and abducens. I'm going to check, just follow my pen light with your eyes only. Awesome. While I'm doing this, you have good movements, and I'm looking for any lid lag or nystagmus, which I don't see. I'm also going to test your peripheral vision. I want you to cover your left eye, and I'm going to cover my left eye as well. You let me know when you see my fingers come into view, and then other eye, and let me know when you see my fingers come into view. Perfect. So yeah, I think that's normal because we saw them at the same time. I'm going to dim the lights and do an ophthalmoscopic exam. I'm looking for the red reflex, and as I look in, I'm going to also be looking for the optic disc, the fovea, the macula, and your vessels. All right, perfect. So I'm going to kind of come in this way to the side, looking for the red reflex. And then with the same eye, I'm going to be looking in, looking at all those. Okay, perfect. And then same eye, looking for that red reflex as I come in. Okay, perfect. Sorry if I blinded you there. Next, I'm going to move on to your ears. I'm checking the posterior, the exterior of your ears. I don't see any abnormalities, any lumps, bumps, or anything of that nature. I'm going to be looking into your ear canal just on the outside first. And I'm looking for color and for anything I can see obstruction wise. I don't see any obstruction. I see just a normal amount of cerumen in there. And then I'm going to pull the pen back and look for your tympanic membrane, which I can clearly visualize. And on this side, no, other side. Your other ear. Thank you. Tilt your chin down just a little bit. I'm just looking at the exterior. I'm going to pull back and look in, and I can clearly visualize your tympanic membrane, which is pearly gray. I'm going to check your 7th cranial nerve, which is your 8th cranial nerve, which is your vestibular cochlear. I want you to repeat the word that I whisper behind you.
Baseball. Flower.
Good. All right. While we're here at your face, before I move on to your nose, I also want to check cranial nerve number 5, which is your trigeminal. So I want you to close your eyes and tell me when you feel me touching you.
Yes. Yes. Yes.
And then cranial nerve 7, which is your facial. I want you to smile, frown, raise your eyebrows, puff out your cheeks. Okay, perfect. And then just real quickly, for your accessory nerve, I want you to raise up against me. Okay, good. Now move on to your nose. I'm just looking for symmetry on the outside. I'm going to palpate for obstruction and patency. Looks good. And now I'm going to look into your nose. If you can kind of look up. I'm going to put my thumb on the tip of your nose and look in. And I am looking for color, which is pink. I don't see any obstructions. I don't see any mucus. I don't see any turbinate. The turbinates look normal. I don't see any issues with your septum. I'm going to have you close your eyes. I'm testing your first cranial nerve, which is your olfactory. Cover one side of your nose. Tell me if this smell is sweet or savory.
Savory.
And then cover the other nose. Tell me if this is sweet or savory.
Sweet.
Perfect. Moving on to your mouth, I'm checking your lips. I don't see any dryness, cracks. The color looks normal. I'm going to check your hypoglossal nerve. I'm going to have you stick out your tongue, move it side to side. That looks good. And I'm also noting the texture and color of your tongue, which also looks normal. I'm going to have you just open your mouth so I can look into the oral mucosa and the gums and the teeth. Lift up your tongue. Up, yep. All your teeth. I don't see any loose teeth. Your gums look normal. I don't see any discoloration. I'm going to have you stick your tongue out as far as you can and say ah. Okay. So was looking at your posterior pharynx. I was looking at your uvula, your pillars. I don't see any patchiness. I don't see any exudate. I saw normal rise and fall when you said ah of your soft palate, and could check your gag reflex as well. So that would text cranial nerves 9 and 10, which is your hypoglossal and your vagus nerve. So I'm going to move on to your neck, and I want you to just look up for me, please. I'm just looking at your neck, and then I don't see any abnormalities. Do you have any tenderness at all?
No.
Okay. I'm just palpating your trachea to make sure that it is midline, and then I'm going to put my hand on your thyroid glands and have you swallow. Okay, perfect. Everything feels good there. I'm going to palpate your lymph nodes now. I'm looking for size, symmetry, movement, and any pain. So you tell me if you have any tenderness. I'm doing pre-auricular, posterior auricular, occipital, tonsillar, submandibular, submental, and then your various cervical, so posterior, deep, anterior cervical, down to your supraclavicular lymph nodes. None were palpable to me. I'm going to move on to your chest, and for the chest, cardiac, and abdomen, I'm going to have you with your shirt off. So if you can take your shirt off for me. Thank you. So first, I'm just looking at your chest, and I'm noticing any abnormalities as far as your use of accessory muscles. I don't see any cyanosis, and the rate, rhythm, and depth of your respirations has looked normal to me. I'm going to just palpate along your chest, and I want you to tell me if you have any tenderness, and also can you say 99?
99. 99.
Okay.
99. 99.
Okay, perfect. And now I'm going to percuss along the back. If you can put your feet this way for me. And then I'm going to do your, also feel for expansion excursion. If you could take a big deep breath. Okay, perfect. And if you can, take a deep breath, hold it. Okay, and then if you can take a big deep breath and hold it. Okay, and I would measure that to be about 3.5 inches, which is normal. And then I'm going to be listening to your lung sounds. Take a nice big deep breath in and out. Good. Good. You can raise your right arm. You breathe in and out. Good. Raise this arm. Breathe in and out. Okay, good. You can relax to normal. Listen up front here. In and out. Good. Okay, so I did not hear any adventitious sounds. I don't know any, I didn't hear any adventitious lung sounds. Everything sounded good. I'm going to move on to cardiac. So I'm going to have you lay back just a little bit. Yep, just like that. So I'm going to have you look left. I'm just looking for any jugular venous distension. I don't see any. Then I'm going to listen over your carotids for any bruits. The bell. You hold your breath for me. Good. Go ahead and breathe. Good. I don't hear any bruits. I'm just going to feel your pulse. Excellent. Okay, perfect. Then I'm going to, I've already kind of looked over your chest, but I'm going to just feel around for any heaves, lifts, formatus. And then I'm going to also palpate the point of maximal impulse, which is your left midclavicular line and your fifth intercostal space. And if I could not feel this, I would have you turn on your left side. Next, I'm going to listen to your heart sounds with the bell and the diaphragm of my stethoscope. I'll be listening to, I'll just say it out loud while I don't have my stethoscope on, but I'll be listening to your aortic, pulmonic, Erb's point, tricuspid, and mitral areas. So you can breathe normally through this exam. Okay, rate, rhythm, depth, pitch, intensity, all of that were normal. I heard normal S1, S2. I did not hear any rubs, gallops, murmurs, or anything of that nature. And now I'm going to be feeling for some of your pulses. So first I'm going to go for your radial and brachial pulses. Then I'm going to just be palpating your trochlear nodes and your axillary nodes. Thank you. I checked this radial pulse already. And I'm just going to feel for your nodes here, your nodes here, and then your inguinal nodes as well. And while I'm here, I would also check for your femoral pulses. I'm moving down. I'm going to check your posterior tibial pulses, which the other pulses were 2+, no thrills. These are like a 1+ just because they're more difficult to feel. Feeling for your pedal pulses, which are 2+, and your posterior tibial, which is more like a 1 plus. And then I'm gonna have you give me your hand. I'm gonna have you I'm doing the Allen test 5 times and then open up, and I release, and I see color come back to your hand. So go ahead and squeeze tight and then let go. And I'm gonna let go and I see redness come back. So that's perfect. I'm looking at your skin while I'm doing this. I haven't noted any abnormalities or lesions. If I did, I would note the size, symmetry, characteristics, and such. I did already look through your scalp when I was looking for at your head, but I don't see any abnormal growth patterns or anything like that to your scalp. And then if I can have you do this with your fingernails, I'm just looking for normal curvature of your fingernails, and that looks good. I don't see any signs of clubbing or any cyanosis. So I'm going to move on to your abdomen while you're here, and I am just looking at your abdomen. I'm looking for any incisions. I do see a recent incision from, you said you had a hernia surgery, and you still have a rather large hernia there, so I'm not going to palpate too deeply when I do palpate, but I don't notice anything else abnormal. I'm going to go ahead and listen really quick to your bowel sounds. Good. You have active bowel tones in all 4 quadrants. I'm going to be listening over for any vascular sounds over your aortic, renal, and iliac. And that all sounds normal. I'm going to be percussing now. So I'm just going to be percussing, and I'm looking for mainly tympany, but any dullness over organs. Next I'm going to do some light palpation. You tell me if you have any tenderness. Any tenderness there? Okay. I'm going to do a little bit deeper palpation. I don't feel anything. Any tenderness at all? Okay, perfect. I'm going to do a couple of tests that will test for problems with potential, I'm going to put your feet up here so we don't have to extend that, so we can have you kind of in a lying position. And I'm just going to hold you back here while okay, go ahead and lay back. Perfect. So I'm going to do a couple of tests that would tell me if you had a potential issues with your appendix. So first I'm going to note McBurney's point, which is midway between your umbilicus and your iliac crest. So that's McBurney's point. Any pain over here when I press on the left side? Okay, so that would be, or if that was a positive Rosving sign, that could be an indication. Next, I'm going to pull your knee up here, flex. I'm going to kind of rotate that in. Any pain at all? Okay, so that was your obturator. So if that was positive, that could be another sign of an issue with your appendix. And then I'm going to palpate up here and have you take a deep breath. Any pain there? Okay, so McBurney's sign, or sorry, Murphy's sign is negative. I would also, during palpation, attempt to palpate the liver to see, and then as well, I could try to palpate to feel your kidneys, which on your other abdominal exam I didn't feel, so I'm not going to do that. I'm going to help you to sit up. I'm going to have you put your feet this way for me really quick, because I'd like to test. Turn your feet this way. You tell me if you're having any pain when you do this. Any pain?
No.
Okay, so negative CVA tenderness, or CV tenderness. So you can put your shirt back on. So I'm gonna have you, we're gonna check your musculoskeletal system. First, I'm looking at your head and neck. I'm going to, here, stand just like this. I think would be it. Face me. Perfect. So I want you to jut out your jaw and then side to side. Okay, perfect. With your head, I want you to go chin to chest and then up. And then I want you to look right, look left, and then ear to shoulder. Okay, so with all of these, I'm just checking flexion, extension, abduction, adduction, and rotation where I can in your joints. So for your shoulders, I'm just going to stand next to you so I can show you. I want you to bring your arms up, bring your arms all the way back. I want you to bring your arms in front one at a time, cross your body. Perfect. Other side, cross your body. And I want you to reach back like you're scratching your back. Yep. Other side, reach back like you're scratching your side. And then over the top here, and then over the top here. So good flexion, extension, and external rotation. Or, adduction. Now I want you to bring your arms up, out, and then rotate. Perfect. And then I want you to bring your wrists toward. So try to keep your elbows straight. Yep. Now try to bring your elbows straight. Bring your thumbs towards each other. I just want to see the rotation of your wrists only. Perfect. And then bring your hands up, fingers out, fingers in, bring them down, out. Okay, so perfect. And then I'm going to have you turn around so I can see the curvature of your spine. I'm just going to pull this up really quick. And I'm just going to kind of palpate down. Can you lean forward just a bit? I'm just looking for any abnormal curvature of your spine. Looks good. Now you can face me, and I want to check kind of your lower extremity. So if you can bend over, touch the floor. Perfect. Come back up, bend back. And then I want you to turn side to side. And then I want you to bend this way and that way. Okay, perfect. You can go ahead and take a seat. One thing I wanted to check also, let me see your hands. Turn them this way. I'm going to do a couple of different tests for carpal tunnel. So I'm just going to tap from here down. Do you have any pain at all or any numbness on these fingers here? No pain or numbness? No. Okay, and then I want you to put your hands this way. Okay, just like that, as flat as you can together. Perfect. And then we would hold this for some time to see if you felt any numbness or tingling down there. And that is the Tinel and Phelan test. So next we're going to look at the, I'm going to have you, I think we might just use this rather than pull that thing out. So go ahead and lay flat. Put your hands up there. Perfect. So I want you to lift your knees up towards your chest. Perfect. And then you can put them down. I'm going to lift your right leg. I want you to move your left leg in towards, and cross your body. Okay, go back. And then I'm going to do the same for the other side. Go in. Perfect. And then if you could lift your legs kind of up and then out. So lift them slightly up. Now go. I just want you to go. I want to see if you can bring them away from one another. So lift up just slightly and open. Yes, perfect. Okay, bring them down. Okay. Next, I want to check. So we're going to have to bring this bottom part out. So if you want to help me really quickly, we'll pull this bottom section out. Thank you. First, I'm going to have you go on your stomach, so we can do that one really quick. I'm going to have you bend your knees and then bring them up off of the bed. Perfect. And then you can roll over onto your back. And can you come up just a little bit? I'm going to just scooch up just a little bit. Sorry. I'm going to have you. I'm going to bring your knee up, and I'm just checking to some of your knee stuff to make sure that you don't have any ligament issues. I'm putting pressure on this way, pressure on that way while I stabilize this. And then looking at your knees, I don't see any of the bulging or ballooning. When I also need to go back for just a quick second to your peripheral vascular system. I would also check your lower extremities while I was doing those pulses down there for just to make sure that your skin color looks good. I don't see any reddiness. I don't see any discoloration. I don't see any abnormal hair growth pattern. And then I would touch and feel to make sure that temperature was normal on both sides and for edema. And then coming back to the musculoskeletal system, I want you to bend your knee up here, and I'm going to just sit on your foot. I'm checking for more meniscal issues with your knee. I'm going to pull forward, and I'm going to push back. Any pain there? Okay, and I would do that on the other side as well. Thank you. So let's stand up again. Sorry. Oh.
Thanks.
I'm going to check a couple of different signs for your shoulder. So I'm going to have you turn around so that they can see the camera. I'm checking for impingement, doing the near test. I'm going to touch on your shoulder. I want you to raise your arm and then lower it. Any pain there?
No.
Okay, perfect. And then turn and face me. Check the Hawken, which is like this. Any pain at all in your shoulder? No. Okay, perfect. So neuro-wise, we did your cranial nerves already, but we're going to test your some of your coordination. We can just do this standing. Stay right where you're at, right here. Face me. Face me. Yep. I want you to do movements of your fingers against those, and you start going a little bit faster. Perfect. And then if you can put your finger to your nose, and then to my finger, and then to your nose, and to my finger, and to your nose. Okay, perfect. Now if you can close your eyes and bring your finger to your nose, the right side and then the left side. Okay, perfect. Next I'm going to check your gait and your balance. If you can walk heel toe. Perfect. And then if you can stand right here, and I want you to stand with your feet together and close your eyes. I'm looking for Romberg sign. And if swaying is normal, but off balance would indicate some kind of neurological problem. And I'm going to have you open your eyes, feet a regular width apart. I'm going to have you bring your hands out in front of you, palms up, close your eyes, and I'm checking for any pronator drift here. And if I saw any drift here, that might be an indication of a neurological problem, which I don't see. You can bring your arms down. And then you can go ahead and take a seat. We're going to be checking your sensory. So I want you to close your eyes for me, please. And I'm going to touch you with something soft and with something a little bit more pointy. And I want you to tell me where I'm touching you and what you feel. Where at and how you feel.
Soft right knee. Sharp right left hand.
Okay.
Sharp right arm.
Okay.
Soft left calf.
Okay, perfect. Now I'm going to be checking the strength. So as I go through this, I want you to give like counterbalance. Or counter pressure rather. So I'm going to start, come towards me just a little bit. I'm going to start with put your arms up. I want you to not let me push your arms in. Okay, and don't let me pull them away. Make fists. Don't let me push down. Perfect. Hands out. Don't let me close. Okay, and then I want you to grab my hands, squeeze tight. Okay, a good grip strength. Next, I want you to press up against my hands. Okay, and then press down, and then don't let me close. Don't let me open. Don't let me pull, and don't let me push. And if you could put your foot up here, push on the gas, toes to your nose. Next foot. Perfect. Push on the gas, toes to your nose. Awesome. And then next I'm going to check your reflexes. So I'm going to start here. You go ahead and put your arm, relax your arm down there. So as I'm checking your reflexes, I'm looking for like the flexion, like the flexion of your muscle, but then involuntary movements there. Perfect. And then go ahead and let that hang there. Doing triceps. And then we'll do your knees. And then your Achilles. Okay, perfect. Just trying to think of anything that I've missed on your reflexes. I think that is all.